Welcome, medicine graduates, to your instructional guide for the hooding ceremony. The hooding ceremony will be held within the graduation program. This significant milestone in your academic journey deserves to be celebrated with precision and dignity. To help you and your loved ones prepare, we have human models demonstrating each step in detail. Your academic regalia includes the academic gown or toga, hood, and the graduation cap. Let's focus on your academic hood. Your academic hood will have a satin lining that extends down from the top, where you'll be putting your head. This brightly colored satin indicates your degree, so it should be facing out. The tapered V-shaped end showing the school color will be worn in front of the neck, while the long or broad rear will be draped over the back. The graduation cap, following the form of a biretta, has no tassel but only colored fringes corresponding to your college color. First, make sure your hood is draped over your left arm. The tapered end should face inwards, while the chevron or school color should be near your hand facing outward. You will hold the graduation cap with your right hand, with the fingers underneath the crown holding it upright. Let's begin by discussing the seating and stage arrangements. Your accompanying spouse, parent, relative, or guest should be seated in designated rows. When it is time to proceed to the presentation area in front of the stage, the accompanying person should always walk on the right side of the candidate. Both the candidate and the parents or spouse should already be on the right aisle when the candidate's name is about to be called. Upon hearing your name, approach the marked position in the presentation area along with your parents or spouse. Your parents or spouse will stand facing the audience while you face your parents. Take a step forward and present your hood to one of your parents or spouse, and present your cap to the other. Next, face the audience, while your parents or spouse will place the hood over your head and onto your shoulders. If you are taller than your parents or spouse, lean forward while lowering your head, or you may slightly bend your knees for your parents to reach over your shoulders. Smooth the front end of the hood so that it rests comfortably over the shoulders. To keep the hood in place, secure the front edge of the hood to the first button of the academic gown and the portion draped over the shoulders with safety pins. Remember, do not add any embellishments to your hoods. The hood should remain as it is, representing your academic achievements. The other parent or spouse will put back on the graduation cap. Again, either lean forward while you lower your head or slightly bend your knee for the parent or spouse to reach your head. Fix your cap. Face forward to the audience and have your pictures taken by the official photographers stationed nearby. Thereafter, you may give brief congratulatory pleasantries. Afterwards, you will proceed to exit the area along with your parents or spouse towards the opposite aisle and return to your seats. Regarding the attire, we suggest semi-formal to formal clothing for your accompanying guests, parents, or spouse to match the formality of the event. Let's recap the key points. Check the proper draping of your hood over the left arm. Ensure your guest is seated in the designated rows. Your guest should walk on your right side as you proceed to the presentation or hooding area. Both should be in the hooding area when your name is called, with your parents or spouse facing the audience. Hand your cap to one of the parents or spouse and offer your hood to the other. While facing front, your parents or spouse will hood you and then place the cap on your head. Have your picture taken by the official photographers. Together, you exit the hooding area. We encourage you to practice these steps to ensure a smooth and dignified hooding ceremony. Congratulations once again, medicine graduates. We look forward to celebrating this achievement with you and your loved ones. Thank you for watching and best of luck. See you at the ceremony.